Uh, we'll talk about WhatsApp, its use and abuse. Many of us are prisoners to WhatsApp. That's the picture of the famous Asrani saying, "Good morning, prisoners of WhatsApp." And most of us are somehow prisoners of this. We have our current AIOS president who hates WhatsApp and doesn't use it. So we have both, but we need to be careful and judicious. It's a great tool if we are careful and judicious in our use of WhatsApp. Can I use WhatsApp to enhance practice? I'll give you examples of people who do that. There's a youngster who's starting practice. It doesn't have too many patients, but he keeps a meticulous record of all his patients and he divides them by, has a method in his computer of storing them by birthdays, by wedding anniversaries, and he also classifies them religion-wise. So he says, I have a lot of free time on my hands. So on birthdays of my patients, like on January 1st, I know there are 11 patients who got birthdays. So I will send them all 11 a personalized WhatsApp and greet them on their birthdays, so also on wedding anniversaries, on Eid and on Raksha Bandhan and on various festivals. You will greet people of the relevant community on this. Now, this is fine when your practice is small and restricted to less than 100 people or so. But it's something that you can use to enhance practice in the early stages. Second is replying to patient queries to an extent. So whether you give your mobile number to patients or not, they get it usually. And then they will send you a question, doctor, should I put 1 drop in the eye or 2 drops? And you have to counter your anger and thank God that the query hasn't come at 2 a.m. on a phone call. And reply to the patient patiently on the WhatsApp. And a quick turnaround time for the patients, because for the patient, it's an emergency. He doesn't know whether you put it 1 drop or 2 drops. So a quick reply, a quick turnaround time does enhance your credibility in the patient's eye. Then you can join professional groups. Most of us, we have a Bombay Ophthalmic Association group. You have a Maharashtra Ophthalmic Society group. You might have a Delhi Ophthalmic Society, DOS WhatsApp group, and so on. So if you join these professional groups, or you can have a Cornea Society of India or a Squint Society groups, where people contribute interesting cases or surgeries and learn from others' contributions. So it's nice to join these WhatsApp groups. Of course, we have a limitation that only 256 people can come into a WhatsApp group. A Telegram is there with a much larger reach. But somehow Telegram is, because WhatsApp came first, Telegram is not really caught on in a very big way. And there are people I know who use paid teleconsultations using WhatsApp video. So there are various ways in which you can have, during the COVID times, there were people who are doing only teleconsultations and they would invite. So you have FaceTime video, you can have the WhatsApp video as well, so that the patient can post pictures or even a video of their eye and show you. And you can, of course, tell the patient that this is my bank account details, please put the money there and then call me after half an hour. And then, therefore, you can charge them for consultation as well. So definitely there are various ways besides the good mornings and the mushy messages that crowd and our WhatsApp. There are ways in which we can use WhatsApp to enhance our practice. If we are using WhatsApp, there is some WhatsApp etiquette. Avoid foul language. Even if you think that everyone is adult and like all ophthalmologists in your group, avoid foul language. It doesn't really help. Even if you want to curse a political personality, don't use foul language. First of all, don't avoid comments on politics and politicians, religion and religious leaders, or on national events in your professional groups, because you're bound to hurt some colleague of yours who doesn't share the same opinion. I mean, I really know of some eye surgeons who even like Mr. Arvind Kejriwal. So, I mean, there are, there's no point in running down somebody or criticizing the way in which that politician has handled COVID or has handled vaccination or has handled any situation. And avoid forwards. Unless they are relevant and authentic forwards, then they're going to benefit the community that you're forwarding it to. Don't, I'm talking about professional WhatsApp now, not about your personal WhatsApp with your family and friends. But avoid forwards on a professional WhatsApp group unless it's relevant. I mean, how does it matter if there is a event which has occurred, an earthquake in Iran, why does the whole Bombay Ophthalmic Association have to see 20 pictures of the earthquake in Iran? It's not really relevant to that group. So it could be authentic, but if it's not relevant, don't put it there. And stick to English in your professional groups, because many of the members are from across the country or from international membership. And you can't put Urdu or Hindi over there and then not having them follow what you're saying. Avoid good mornings or clever, mushy forwards. Remember that there are professional people who are designing these forwards just to enhance the use of the medium or to enhance the use of cell phones. So avoid all these. You can do it in your private messages to your mistress or girlfriend, but avoid these in the professional group, because it really hurts. You open a forward, you open a Bombay Ophthalmic Society group, and you don't really want to see 20 good mornings or happy birthday, sir, or whatever type of thing. You do this if you want to greet someone on a special day or even every day because you love that person. Do it on his or her individual cell phone. Then, if somebody posts a good surgery or a case report, please avoid these thumbs ups or head claps or whatever. Send an individual message. That person will really appreciate it. And imagine if there are 256 people in the group and one person has posted a surgery and 255 people put a thumbs up. I mean, I have to wade through 255 thumbs up to see that surgery. So it's really disgusting for most people, and people leave the group because of this. So always scroll up to confirm that you're not repeating a news item. You're so thrilled to be the first one to report that Harbans Lal has become the president of the new vice president of the AIOS, that you will send Harbans has become the president, but you don't see that 5 posts before you somebody else has done it, and 3 posts before that person somebody else has done it. So don't repeat a news item. Confirm that somebody else has not done it first before hitting the send button. And of course, if you have sent something in error and then you've scrolled, you still have that golden hour in which you can delete for everyone. So there is a delete for everyone app with a button which has been introduced. So right click, find delete for me, delete for everyone, and click delete for everyone. You have 1 hour in which to rectify your error. Then beware of the university of WhatsApp. Avoid sending news to a professional group without verifying its authenticity. Some eye surgeons have been prematurely killed on WhatsApp also, which is unfortunate but true. Somebody has reported the death and then I've checked up by calling up that eye surgeon, and he is very much alive in a weak voice, but he says, Quresh, I'm fine. So it's very sad. I mean, I'm giving you extreme examples, but don't post news unless you're verified it yourself, just because you've heard it or seen it on some other group. And another important role that we can have is if you find unverified stories in non-medical groups like Baba Ramdev's Magic Drops or something like that, and it's even say in a Rotary or a Lions Club group, you are the one who's an expert. So please verify and tell those people that that's untrue. That's not. I found a beautiful picture, the movie on eye donation, which was completely factually incorrect. The father donates his eye to the blind daughter, and then the father goes blind, and so it was completely incorrect and painting such a wrong picture of eye donation. So in 4 or 5 different non-medical groups that I took pains to point out how eye donation is actually done and how that one should not be propagated. Please don't make it viral. And don't run down other pathies in non-medical groups. It's all right in our groups, but please remember that there are huge fans of all the Baba Ramdevs and types like that out there in the big bad world. And it tends to backfire on us. They think that you're pulling them down in order to enhance our practice. So be very gentle about things that we don't know in non-medical groups. Yes, you can say that we have no evidence that this works or whatever, but don't run down somebody, or don't run down a full pathi like a homeopathy or an Ayurveda or something, because it tends to backfire on us. Remember, we are the most expensive pathi in the market, and people always feel that we are out there only to make money. With this, I thank you so much for your attention, and we'll go back to our discussion.